Number one, I'm going to explain cardio using Big Mama, your grandmama. My grandmama, your grandmama, Big Mama. And I'm going to explain it as to how it should go in a normal person, and then we're going to transition into heart failure. In a normal person, you go visit your Big Mama, and she has swollen ankles. And you say, oh, look at those ankles, Big Mama. You need to elevate your legs and make sure that swelling goes down. And why did you tell her to elevate her legs? What was the reason for you to tell her that? It's called venous return. Agree? So you were trying to help her get her venous return, which is blood in the veins going back to the heart. Now that's important because veins have to kind of work uphill. Because the blood from your toes has to get all the way up to your heart, you have to go uphill. And in order to facilitate all that blood getting back to your heart, you have something called valves. Valves in your veins prevent backflow. It doesn't matter if it's a valve in your heart, which we'll talk about later, or if it's a valve in your leg. Valves prevent the backflow. So if Big Mama has old valves, which she would, then her valves do not prevent the backflow, and that's why you told her to elevate her legs above the level of her heart so she could work with gravity to get the blood back. Because she's older, and all older people have funky valves. Now, she did exactly what you said. You kind of mentioned to her that she probably should cut down on the salt as you see her shaking salt on pizza. But so you told her, maybe, no, you should cut down on the salt. She said, okay. Now, so she elevated her legs above the level of her heart. The blood in the feet is facilitated back through the heart, but it's going to go through the right side first. Therefore, the right side of your heart, everyone wants to think veins. You have 2 letters to remember on this exam, and it covers almost everything. RV. The right side is always veins. The word veins always means swelling. We started with Big Mama with swelling, didn't we? So right side, venous, swelling. That sounds good to me. All right, so there you go. Pen should be down. Y'all just so good at writing. I know, baby. I know, Sugar Plum. But you can't write and listen right now. So if I set the stage, you're going to love it because all this shit is explained with this right here. Now, so you did. You told her to go ahead and do the damn thing, or elevate her legs. She did just that. The blood entered through the right side of the heart. When it entered into the right side of the heart, it had to go through the biggest vein in our body. Agree? That would be the vena cava. Another V word, huh? This blood that returned to the right side of the heart through the veins is considered volume. Volume, veins, fluid, preload, which we'll talk about. Volume, preload, which we'll really talk about. So the volume of blood returning to the heart, or preload, is going to go through the vena cava first, the biggest vein in your body. It's going to head from that point into your right atrium. This is a no-brainer. From that point, it's going to go through the valves. You try it before you buy it. So tricuspid valve first. Try it before you buy it. Bicuspid's on the other side. So it's going to go through the tricuspid valve. And if that valve is funky, well, you can imagine. But normally it's going to go through the tricuspid valve, and then it's going to go into the right ventricle. From the right ventricle, it's going to go into the pulmonary artery. That's so weird because, hold on, venous blood is not oxygenated, so it should have stayed in the veins. But here you're going through a pulmonary artery. So your job is to remember, as we go through all of these teachings today, that this pulmonary artery is the only artery in the whole body that receives venous blood. When we go through the pulmonary artery, the key here is pulmonary. We're officially in the lungs. Now, when I talk about lungs, the word lungs going forward as I talk means oxygen. Because you dropped off your CO2, you picked up your oxygen, and then you did all of this gas exchange in the alveoli. Oh, that's going to be important in a minute. Because if you did it in the alveoli, the place where you have the gas exchange, if those alveoli become collapsed later, as they do with ARDS, then no amount of oxygen to the patient will increase your O2 level because the place where the gas exchange occurs has collapsed. So we'll talk about that with ARDS. So now we have all of this blood in the lungs, dropping off CO2, picking up oxygen, where? In the alveoli. When they collapse, it's atelectasis. Now, we keep on moving, right? Now we're going to move out of the lungs. Would you agree we're oxygenated blood now? So we are called arterial blood. Now we're going to move out of the weirdest structure in the world called a pulmonary vein. It's the only vein that is receiving arterial blood. Agree? Okay, now when we move out that pulmonary vein, life is going to get gooder and gooder because we have blood that is oxygenated going to the left side of the body through that pulmonary vein. It's going to go into the left atria. Now, the left side, you have two more letters, L for lungs and left, and A. And again, we'll talk about it. The A is to remind you that this is arterial blood. The L is to remind you that we're talking lungs for oxygen. The L is also to remind you left side. Now we have this blood in this right atria. Now the job of the atria is very, very special. We consider it to be like a party from back in the day. Some of y'all still kind of young, maybe you went to this party recently before nursing school. But the way parties back in the day used to work is you had an upper level and you had a basement. In the upper level, we say the atria were up there. The atria, or upper level of the party, was where you were chilling and filling. Filling with what? In your case, alcohol. In the heart's case, blood. What is this called? It's called diastole. Chilling and filling. In the basement of the party, which was your ventricles, this is where shit was going on. This is where the pumping and the bumping and jamming and flashlight, all that shit was going on. I'm just saying I went to a couple parties. Just two. So the ventricles are the pumps of the heart. So when you move this blood from the atria to the ventricle, it's supposed to be pumped out of the body. Is that clear? We got a little problem. We're going to stick around the atria just a little bit. In the atria, for patients that have AFib and A-flutter, it's going to stick around in there. It's going to stick around longer than it should, filling up on blood, and it's going to develop clots. You knew this. Those clots are going to lead to a stroke. You knew this. An embolic stroke, okay? It's just a little backdrop. Now, so the blood moves from the left atrium through the, which valve? Try it before you buy it. Bicuspid or mitral, down to this left ventricle. And that pump is huge. It's the biggest pump of the body. It better be. Because over here on the right-hand side, that little pump, the right ventricle, it wasn't that big. It didn't even have high pressures. So when we do pressures, we know that the right side of the heart has a lower pressure because all it has to do is pump the blood next door to the lungs. Oh, no. The left side, that pump is huge. And the main artery supplying with all the blood that you need is called the coronary artery. And so this pump is so big, it has to pump blood through every artery in your body, starting with the biggest artery you have, which is your aorta, and it's got to get the blood to the toes. It's got to get the blood to the nose. It's got to get the blood to the top of the head. It's huge, huge, huge pump. So, of course, if anything's going wrong on this side of the heart, well, what temperature is blood? This is not a fucking trick question. What temperature is blood, everybody? Okay, you think it's warm? I'm going to try this one more day at a time because somebody's still asleep down here. What's the temperature of blood? Still not good. What's the temperature of blood? Warm. Oh, thank you, Jesus, they're alive. Okay, warm. When you don't have circulation, what do you have in your body? Cold. What's the color of blood? When you don't have circulation, what is that color? Pallor. Pallor. No color at all, right? Pallor. Blue is really ridiculous, but blue is allowed. Okay, cool. Now, you just did your little PVD, peripheral vascular disease, on the low. Peripheral artery disease, peripheral vascular disease on the low. We'll get back to it. Cold, pallor skin. Okay, so we have to pump the blood out of the left ventricle through the aorta. The aorta is the largest artery of the body. So you would agree that if the aorta is ballooning, we're going to have a problem? That's an aneurysm. You would agree if the aorta is torn, we're going to have a problem? Because you're supposed to get all the blood down to the bottom of the toes. Now your little stuff is torn. That's crazy. You would agree if the aortic valves are funky, we're going to have backflow. Going to sound like a murmur. All this old dumb stuff in the heart. You would agree that if we can't get the blood out of the left side of the heart, we're going to be galloping and adding sounds and all kinds of stuff. Okay, so it's a crazy area of the heart to not get the blood out. It's like, what are you doing? Okay, so this aorta is critical. The first stop off the aorta is the brain. By way of the carotid artery and the cerebral artery. If either one of these get blocked, we call that a stroke. The second stop off of the aorta is the kidneys. If you don't have a blood pressure, which is determined over on that left side, if you don't have a blood pressure, which we consider to be blood perfusing kidneys, then you don't have kidney function. So you don't have a BP, you don't have a PP, because your kidneys can't make P. So far, so good? This is why the heart and the kidneys are tied into one. When you learn this stuff in school, you learn it very disjointed for a stupid freaking test that week, and then you fucking forget it all. But I'm tying it all together, okay? All right, so you're going to have a problem with this patient if either of these sides fail. Let's make this side fail first.